I am thrilled to be here today and just want to begin by thanking the individuals who put this symposium, this very important day together. And so thank you for having me. I was stuck in Chicago yesterday. You guys heard about those tornadoes. So I'm very happy I made my connecting flight and I'm here this morning. I'm thrilled to talk with you today about an area I am incredibly passionate about, and that is healthy public policies, health in all policies, health impact assessment. And in my time today, I'm going to address these three objectives. So I'm going to talk about why we want to consider health when adopting and implementing public policies. Why should we care about this? Why is this important for public health? The second thing I'm going to do is talk about how a health in all policies approach can promote health equity. And finally, I'm going to share with you some examples of how several strategies are being used around the country to bring health into the policy process. And that's going to include highlighting some work that I've been doing in the area of health impact assessment. So I know there's no formal course here in HIA, so I hope learning a little bit more about health impact assessment will be beneficial to those of you who are interested in that tool and that process. So we're here at School of Public Health. I'm sure that this is no surprise to any of you in this audience, but where you live matters to your health. Where we live reflects and affords us opportunities for access to healthy foods, to housing that is safe and healthy for us, to kids being able to walk to school, to have access to education. I love showing this slide for this one on the bottom. If you can see that circle, I'm sorry, there's a laser pointer. If you can see the circle right here, this is a person crossing the street in Atlanta. This is a real picture. And when you look at this, I want to just remind people that when we make decisions about our roads, for example, oftentimes the individuals who are doing that aren't thinking about risks like to pedestrians or pedestrian safety, those kinds of issues. I do a lot of work in injury prevention and control, and a big part of what I do is helping people in transportation think about how do we avoid designing our roads like that. Those are health issues. Those are part of health and all policy issues. Because of the fact that many of our decisions about this society are made outside of the focus of the realm of health, we know that decisions that are being made have significant health implications that often go under-recognized, and these are oftentimes unintended. So when I talk to colleagues in other sectors, what we see is that their priorities might be to advance transportation, right, to focus on mobility, getting people quickly from point A to point B, and they oftentimes don't think about, well, what do these decisions mean for health? And because of that problem, I believe as health individuals, as public health people, it's important for us to help think about what are those health implications and how can we work more upstream to try to make sure that health is considered in these decisions. This is a figure I love to show. It is from the World Health Organization Commission on the Social Determinants of Health, and it describes the root causes of health. So when we think about all of the factors that impact our health, it's really a very small percentage that's related to our healthcare system. It's really more about the social, economic, and political factors, where we live, work, learn, and play, our public services and infrastructure. And really the smaller circle of this rainbow are our individual behaviors and our individual factors. So contexts matter. The broader macro, political, physical, economic conditions matter for our health. And if that is the case, if you look up here, we see then that these factors are oftentimes affecting us by decisions made outside of health, outside of the health department, outside of our healthcare system. The Institute of Medicine in 2002 came out with a report called The Future of the Public's Health in the 21st Century, and in that report there's a great quote that I embrace, and it says, "Public health agencies alone cannot assure the nation's health." And I don't say that to say that public health departments and institutions are not critical for health, but what it means to me is that they alone cannot assure improvements in population health. They need to work with other sectors. We need to work with other sectors and think about how these other institutions are making decisions that inform health. When we look at the phrase health in all policies, if you were to also scan the literature, maybe the dean saw this when he did his Google search, there are several definitions that come up. But one of the things that you see that's really sort of central to any approach is that a health in all policies approach grew out of the recognition that factors outside of the healthcare system play a large role in determining our health status. Also, There's a recognition that not all determinants of health can be controlled by policies within the health sector. So again, we're thinking about these factors that are informing our health, influencing our health outside of the health sector. This is one formal definition of health in all policies. I won't read it verbatim. I will highlight for you, and think in the next slide or the one after, some of those key elements of a health in all policies approach. But what we're talking about is a systems level approach. This isn't one decision made. This is a systems way of looking at health differently. And I believe that this is important for us as we move forward in public health. When we think about what do we need to realize improvements in population health, to reduce disparities, embracing an approach that helps us recognize that we need to come together, that we need to look at these decisions made in other sectors, what they mean for health, will really help us to realize those improvements in population health and health equity. I think about healthy public policies because I focus a lot on the policy process, which is not just policy formation, but also adoption and implementation. So how do we integrate health into all those phases of the policy process? That is also part of health in all policies approach. The acronym for health in all policies, we tend to say HIAP, so I might use that sometimes, or HIAP. But when we talk about an HIAP approach, we oftentimes think about these two paths to achieve that same goal. The first one is some specific initiatives or programs undertaken by another sector with the purpose of improving health. So for example, Baltimore City has a complete streets policy, and there's specific language in that resolution that says this is how health is going to be affected by this decision. So that's just one way that we see health in all policies being operationalized. The second way is really broader, where we think about how do we integrate considerations of health into these non-health decisions. And the goal of this is to maximize those positive health impacts, minimize those unintended negative ones, to foster intersectoral collaboration, and finally, how do we work more efficiently, ensure that sectors are not working at cross purposes. And I'm going to talk a little bit more about how do we actually make this happen, because this might sound like a great idea, but how do we actually do this? So here are the key elements that I mentioned of a health in all policies approach. Again, a more systems approach. And when we look at health in all policies approaches that have been implemented worldwide, these are the central elements that we see. The first is that you have engagement of stakeholders, especially in those non-health sectors. And this is critical to support intersectoral collaboration. There's also a focus on those social determinants of health, those things I showed you in that rainbow. So looking at where people live, work, learn, and play and travel, and engaging with those stakeholders from those sectors. A health in all policies approach promotes health and equity and sustainability. Again, so how do we have decision-making that's more efficient, that addresses health in a broader way, and helps individuals who are not in the health sector think about how what they're deciding to do could impact health. This isn't just about benefits for the health sector. A health in all policies approach benefits multiple partners. When I think about working with individuals in the transportation sector, I can't just come in and talk about all the benefits for health. We need to think about, well, what are the benefits of a HIAP approach for the transportation sector as well? And finally, a very effective health in all policies approach involves accountability. So who's accountable for those decisions? Who's accountable for implementing those approaches? And when we look at some model health in all policies approaches, it addresses accountability as well. As the Dean mentioned earlier, we can see that health in all policies as an approach really came out in 2006, really for the first time by the Finnish president at the time. And when we look to see what's happened since, I just wanted to highlight a couple of things. In 2010, there was a Health in All Policies international meeting in South Australia. And at that meeting, it was put forward that a health in all policy approach can really help governments achieve their objectives. And so the thought was that if all sectors are including health in their decisions, not only will we have a healthier population, a healthier workforce, but also we will ensure efficiencies and that government goals are met in a way that are not at cross purposes, as I mentioned a bit earlier. The health in all policies approach has continued to be influential internationally, and we even see that there was the spirit of health in all policies was included in the recent Global Conference on Health Promotion in Finland in 2013, and even the Millennium Development Goals. So again, we're seeing a broadening and folks embracing this approach worldwide. There are lessons and examples of health in all policies right here in the US at the federal level. If you look at Healthy People 2020, there's language about engaging multiple sectors coming together. That's a health in all policies approach. We also see language about health in all policies in the National Prevention Council. Their 2010 annual status report has specific language about integrating health criteria into decision-making across sectors. This is a health in all policies approach. At the state level, California has a Health in All Policies Task Force. This was created by an executive order from Governor Schwarzenegger several years ago, and the task force continues to work together and to implement approaches to consider health in various aspects in decision-making statewide. If you're interested, I would encourage you to look at the website for the Health in All Policies Task Force, and you'll actually see their reports, you'll see who's involved. And I think what's so impressive about this task force is that it involves individuals from all of the key agencies within the state. Where I come from in Baltimore, we have a cross-agency health task force at the city level. So this is a way the local government is embracing a health in all policies approach. This task force, we call it our CAT team, involves representatives from all city agencies that are working together to support the city's health goals. So the goals for Healthy Baltimore 2015, which were established by the prior health commissioner, said, well, we cannot achieve a healthier Baltimore unless we engage all of the key sectors. And so the CAT team involves individuals from planning, from housing, from transportation, from energy, from sustainability, climate change. All of these groups are coming together to help think about how the decisions they are making can affect the health of residents in Baltimore. This is also recognized as a way to address inequities in the city. We have significant health disparities in Baltimore, and there's a recognition that by focusing on the social determinants of health through these decisions being made by the CAT team, it's a way to help address these inequities and address health disparities. When we look at health in all policies, we know that efforts to integrate health into these non-health sectors are most successful when we have these three things here. One, when decision-making processes are transparent, right? So when we know who's making the decisions, we know how the decisions are being made, and that allows individuals to see how health can be integrated into that decision-making process. The second thing is when we see a decision-making process that's more democratic and inclusive, involving various stakeholders, involving community members, involving individuals affected by the decision. Again, I'm not saying that that's easy to actually operationalize, but it's critical for me, and it's important in these processes when we see health in all policies being more successful. And finally, I mentioned accountability earlier. I'll say it again here. We know that when decision makers themselves are held accountable for their actions, we tend to see a health in all policies approach being more successful, more effective in communities and in states and in countries around the world. That vision of achieving health in all policies is not without some challenges, and I wanted to just mention those here. The first is that there's little to no common language between sectors. How many people have friends who are transportation engineers? You ever try talking to them about health and odds ratios and social determinants of health? It doesn't work. And so how do we then bridge those communication gaps? How do we help ensure that my goal is to ensure pedestrian safety while you as a transportation engineer are trying to ensure people get quickly from point A to point B? How do we talk about that in a way that makes sense to both of us? We oftentimes see also no formalized interactions between health and other sectors. How many times are individuals from other sectors in a room together? We still tend to be very much in our silos. I mean, our funding is often very specific and driven by silos. But we know actually if we have calls for proposals that say you have to work with folks from various sectors, it's going to happen. And finally, when I think about my work with policymakers, I believe that there's this gap between public health and policy where we oftentimes aim to be very science-driven when policy processes are driven by other things such as constituents and economics and politics. And so for us as individuals who are not working in that world, I think it's important to understand those drivers of decisions by policy makers and for them to help understand, well, how are we making our decisions as well? As I mentioned earlier, HIAP is a way to address health equity, particularly because of its emphasis on social determinants on health, the emphasis on inclusion as a process, and on stakeholder engagement. And when we think about health equity, we think about the inequities and opportunities and how those lead to inequities in health. And for me, as a person who spends time thinking about health disparities and thinking about vulnerable populations, I really see a health and all policies approach that addresses these differences in terms of social, economic, environmental, and political conditions as a way to help address these inequities. So if we can look at those policies and programs being made to inform these root causes of health, if we were to improve those, if we were to shape those in a way that maximize health benefits and minimize the negative ones, I believe that we can address these root causes in a way that will improve health for all. Again, because of its emphasis on the social determinants of health, on those non-health sectors, we can be effective in terms of a health and all policies approach to also engage vulnerable populations in the policy process. So how do we engage the communities that we're working with? I think we're going to hear a great example from our second speaker about involving communities and involving individuals in decision-making processes. We know that that's a key element of health and all policies. And as I said earlier, when we look at HIAP in various places, places that do that well tend to be more effective with this approach. So you might be thinking, well, Keshia, again, this sounds really good, but how do you actually do this? And there's no single way to do, quote unquote, health and all policies. These are just some examples. So we see individuals creating cross-sector government structures. We see health being integrated into general plans and zoning updates, for example. In Baltimore, we did a rewrite of our zoning code, and health is all throughout that zoning code. There are ways that you can improve health by thinking about how are we using our land in terms of zoning. We also see surveys and tools being applied within planning departments to say, well, when we're making decisions about how we're designing a community, are we thinking about health? We've seen an increase in terms of health language being actually included in RFPs. We have a proposal out now for bike share in Baltimore, and that RFP actually has some specific health indicators in that proposal. So when people want to run our bike share program in the city, they have to think about health. They have to think about equity before they get selected as the vendor. And finally, health impact assessment, and this is an area that I spend a lot of time on, and I'm going to tell you a little bit about HIA and how HIA is one aspect of the health and all policy approach, and I'll give you an example of that as well. So let me just define health impact assessment, again, this other acronym, HIA. And HIA is a structured process that uses a variety of data and methods and stakeholder engagement to identify potential public health consequences of decisions. So our goal here is to maximize those positive health benefits, minimize those negative ones during the decision-making phase. So we want to do this before the decision is made. So we want to work with our stakeholders, we want to work with the decision makers, and come up with ideas and strategies to minimize those adverse health impacts. And this is not some academic exercise. We develop pragmatic recommendations based on the assessment that we can then implement and hold individuals accountable for ensuring that they're implemented well. If you're interested in learning more about HIA, the National Research Council came out with a report in 2011 about HIA in the US as a practice. You can find this report online and just search for Improving Health in the US, the role of HIA. Health impact assessment, I mentioned earlier, it's one way to achieve health in all policies. HIA affects those social determinants of health. So HIA is asking, well, how does a proposed project, policy, or plan affect these things that we know affect health and in turn lead to these health outcomes? So what we're doing is we're looking at decisions being made that affect housing, that affect parks and natural space, that affect education. And we're saying, well, how can we help decision makers in these sectors make their decisions better to not have a negative unintended consequence on health? Health impact assessments can be applied to a range of sectors. We've seen most HIAs around the built environment, but they've also been applied to decisions in transportation, natural resources and energy, housing, labor, etc. This is just a couple of examples, I think, for you to just see how HIAs can be applied. We see them applied, again, to a variety of sectors. And here are just a few HIAs that have been done. Here's one, again, on the city's Baltimore proposed zoning changes. This was one we did in Baltimore. And also, HIAs can be applied broadly to policies, programs, or projects. We just completed an HIA last year about proposed changes to the federal Supplemental Nutrition Assistance Program. Clearly, changes to SNAP are going to affect health. Health was not a part of the decision-making process. It was really all about saving resources. So our team came in and said, well, here's how these changes could affect health. I'm not going to spend a lot more time talking about HIA because my time is short today, but I do want to highlight for you some important things about HIA. So health impact assessment provides a framework for community capacity building and empowerment. Stakeholder engagement is a critical component of the health impact assessment process. HIA involves a broad range of impacted individuals. It involves decision makers who are actually putting forward the decisions. It involves other key stakeholders. It involves individuals who will be affected by that decision. And it also involves a range of health impacts. So we broadly define health. So physical health, mental health, environmental health, and thinking about how that decision in whatever sector it is can affect health. And again, we want to make recommendations to maximize those positive health benefits of that decision and minimize those negative ones. HIAs also address health inequities. And based on the evaluation work that I did, we know that HIAs increase transparency, support a more inclusive process, community engagement and democracy in the decision-making process. Again, it's been shown to be a way to bring people into the decision-making process who are marginalized or might not be part of that decision or might be outside of the policy process. HIAs have been proven in certain instances to be a way for people to be involved in those decisions. These are just the key values of HIA. Democracy and, again, transparency, I think, here is critical. These two go hand in hand. We're talking about equity. Again, it's been a way, HIAs are a way to address those inequities, address those social determinants of health. Another key value is sustainable development, ethical use of evidence, and holistic approach to health. And I just want to say here, as somebody who teaches HIA at Hopkins, these are critical, and we spend time on these in our class because as HIA practitioners, we want to assure that we are getting the best available evidence, that we are objectively looking to see how health can be improved, and engaging individuals, addressing equity, addressing health in a more holistic approach. So here are the key points of HIA. Again, it's conducted to inform a specific decision. There's a broad analytic framework. Involves collaboration with stakeholders. A very pragmatic process in terms of the outputs. Again, we want to have recommendations here that actually can be implemented and that are pragmatic and that individuals can be held accountable for implementing. And again, very focused on solutions. This isn't something that we want to develop this report that sits on a shelf. We actually want to make a difference. I want to give you a really brief example because I think this really codifies this in people's minds. Here's an example of an HIA that was done in Oakland. It's in an area called the Jack London Gateway. Briefly, it was a proposed development of 55 low-income senior housing units near two major freeways in the Port of Oakland. And essentially, this property would be located in a very busy area. There was a lot of crime in that area. And if you look at this map, here's the project site, here are the two interstates, and here's the retail. So we're talking about seniors who are living in a crime area. Do you see people walking down this highway to get to this retail? Right? So again, we think about the decisions here, and we're not saying that the planners intentionally were trying to increase risk to the residents. No, the fact is that the decisions about where to put this development, health wasn't part of that process. So this team did a health impact assessment, and ultimately, just I'll tell you the punchline, they focused on these health outcomes and developed recommendations that addressed air quality, because there was clearly some increased risk of illnesses related to living in a home right near a major highway. And so they went ahead and made some recommendations to the developer, who then implemented air filtration. And where possible, changed the windows from facing the freeway to the other side of the apartment. Very pragmatic solution. They also looked at noise. Again, imagine living next to a major highway, and the developer added a noise buffered courtyard that we see right here so that this building was not right up against the road. And there were also safety concerns, right? Again, if I'm a senior living in a building and I need to get to amenities and retail, how am I getting down there? You know, developing a shuttle to take people. What are the ways that we can implement traffic calming? There's a whole story about this example, but I just wanted to tell you this is one way that health is brought into a non-health decision. These are some of the outcomes that resulted from doing a health impact assessment of a development, a proposed property, again, where health wasn't at the forefront of that decision. When Sarah read my bio, she mentioned that I was the interim director of the Health Impact Project for a bit, and I want to just tell you a little bit about what we do with the Health Impact Project. We're promoting the use of health impact assessments and building the field and making the case to policymakers and decision makers about why they should routinely consider health. And I wanted to just show you this map. You know, we know those obesity maps that show the growth. I'm going to show you just 2 maps, although I have many more I could show you about health impact assessments and the growth. And I want to highlight right here in Minnesota, where back when a review was done in 2007 of HIAs that have been completed, this is what the field looked like in 2007. This is where we are today. And I hope that when you look at this map to this map, you see the tremendous growth. I teach HIA students say, well, I get a job. Yeah, you'll get a job. This is growing. You know, these are skills and tools that are really critical. And I think even if you don't do HIA, the process of doing HIA has transferable skills. You're systematically thinking about an issue, and there are lots of things that are marketable there. Here again, there's been some growth here in Minnesota. We've seen a lot of growth in California. And we know now, this is even a little bit outdated, it's the end of 2014, we think there's about 330 or so HIAs that have been conducted or in process right now around the country. There's also been some ones of federal decisions, so I've been involved in a few of those. And again, how do we help federal decision makers think about how the decisions they're making affect health? I wanted to just wrap up by talking, I'm sure our commissioner will talk about HIA work, well, I'm not sure, I suspect he will talk about HIA work here in the state. And I will say that Minnesota has really, I think, emerged as a state where we're seeing a lot of activity, and there's a HIA coalition that really grew out of the need to build the capacity of practitioners here in the state. And the coalition is very impressive in terms of including an array of individuals. And at the Health Impact Project, we're providing a little bit of support for the first statewide conference in the fall in HIA. So we're really excited that some people from our team will be back here in the fall for this conference. So as my time is coming to the end, I wanted to just wrap up and share some final thoughts on health impact assessment on health and all policies. And I hope that I've been able to convey that HIAP is a systems-wide approach. It's not a single policy. It's a new way of doing business. And I've found that it really takes a champion. It takes accountability. And for anybody who engages with individuals who can be those champions in other sectors, consider really talking about how a health and all policies approach can benefit both health and individuals in their sectors and their goals. HIAP is also a critical way to address equity issues. I've talked about that. I've said that several times today because of its emphasis on the social determinants of health. I was at the International Health Impact Assessment meeting a few years ago, and we were talking about health and all policies, and somebody said, well, maybe it's not all policies, maybe it's really some policies. Is this the right tool for every policy? I don't think so. I think that we need to have some really good screening criteria about when do we embrace a HIAP approach or a health impact assessment. Ultimately, we want to improve health, and so ways that we can do that are effective and that are sustainable is really the goal. And finally, even though I talked about health impact assessment and I spend a lot of time doing HIA, I tell people that while we might strive for a health and all policies approach to decision making, HIA is not always the right tool. If you remember earlier in this presentation, I gave you several examples of ways to achieve health in all policies. And I do think, though, that HIA is one way to consider achieving that goal, but there are also many other ways. So with that, I want to just say thank you for your attention. I look forward to questions during the discussion, and I hope I provided an overview of health in all policies and about how it could be used to address equity issues and health disparities. So thank you very much.